Welcome to Health Commune. We call it a global health literacy project. We are on a mission to help people educate about regarding their health with expert-led conversations. Today's topic is very important, but I think most neglected in my world. At least I have a daughter who's a teenager. We are talking about oral hygiene, and our today's guest is Dr. Manu Rathee. Thank you so much, doctor. It's very difficult for people to sacrifice their Sunday, and you're here. That means I'm sure that you are very committed to the mission and you're aligned with what we are trying to do. Could you please help me understand what you are working, where you're practicing, and a little bit of your background for our audience to know whom we are talking today?
Thank you so much, Dr. Smita. So nice to join you on this Sunday morning. And I'm happy to join you for the masses on the Sunday. And I am prosthodontist. Currently, I am serving as senior professor and head of the department at PGIDS with the Health University, Rohtak, in the state of Haryana.
Okay.
And my area of work is that I'm a clinician. I help the patients with their oral health problems. In addition, I am a researcher and I'm an administrator as well. So I contribute to the specialty of the dentistry.
Beautiful. I'm your host for the day. I'm Dr. Smita. I'm a founder of Health Commune and I'm running a couple of organizations. I'm a physician, but not into practice. And oral hygiene, I think I'll be representing people as well as my daughter, teenage people, as well as myself. My first question to you regarding oral health is, what's the most common oral hygiene myth that you think it is there across all the ages?
The myth is that generally the people avoid the oral hygiene and it is not taken as a priority and it is not taken as it should be a routine one. One thing is that the brushing method, the correct method is not adopted. The wrong one is practiced. And the critical concern is that whatever happens, the person stops maintaining the oral cavity clean. Like somebody falls ill, somebody is traveling. So the first thing, they stop cleaning the oral cavity. So that is the biggest hurdle in maintaining the oral hygiene. So it is under no condition the person should stop brushing the teeth, whether the person is ill, bedridden, even after the surgery. So that is the biggest myth, that we should never stop cleaning the mouth.
True. So my first question to you is, what are the most common mistakes that you see people are doing across all the age groups when it comes to oral hygiene?
Yeah, Dr. Smita, for oral hygiene, the most important thing and the single most important thing is brushing the teeth. And not brushing the teeth in the correct way is the biggest mistake. And another critical concern is that very frequently people stop brushing on a very simplest of pretext. Like somebody falls ill, slightest of fever is there, maybe their mobility is affected and they stop brushing the teeth. And specifically, if something is done in their mouth by the dentist, for example, somebody has got a small filling done or one tooth extracted, then they consider it as a pretext to not to brush. So the biggest mistake is to stop brushing. There is no situation in which the brushing should be stopped on any day. Even when the patient is hospitalized, bedridden, in such situation, if the patient or the person cannot brush himself or herself, the caretaker should be there or some alternative to the brushing should be adopted. But never ever stop cleaning the oral cavity under any conditions on any day.
But when I ask you, brushing is just one aspect of the overall dental care. If I need to define what exactly is a good oral hygiene?
See, oral hygiene means when would be considered mouth as clean? When the whole mouth is clean. And the mouth is not limited to the teeth. Teeth are one part of the mouth. Through brushing, we clean teeth. So it is part of the mouth is clean by using the brush. In our mouth, apart from the teeth, other tissues are there. We have inside of the lips, cheeks, and most important is the tongue.
Yeah.
Right? So when we are eating food, the food is not sticking only to the hard part of the teeth. It is sticking to the lips, to the cheeks, and gets impregnated onto the roughened surface of the tongue also. So a clean mouth, I would say it will be when all parts of the mouth are clean. Teeth are clean, the inside of the cheeks or the lips and the tongue, everything is clean, then only it is a good oral hygiene.
Okay. So the complete mouth should be clean. Is there any protocol for a typical day that usually we know, right? Like you have to brush the day once you get up in the morning or before you go to bed. And that's all I think I am aware of. So is there any protocol a particular person can follow which will take care of the good hygiene, oral hygiene?
Yeah, the simplest way to understand whether mouth is clean or not. So we should be aware, when are we eating? Is the food getting stick? What is the nature of the food we are taking? It is only liquid, then it is not likely to get sticking to the tissues. So whenever we are taking solid food, and that too particularly the sticky one, so there is more likely to be sticking to our teeth and the other parts of the mouth. So we have to clean accordingly. But as you say, everybody is aware also, brushing twice a day is preferable. And if somebody is in a condition not possible, then it is better that before going to the bed, one should brush. Because
Okay.
In the daytime we brush in the morning, then we eat something also. It is not practical also that we can keep brushing after eating any and everything, right? But brushing the teeth before going to the bed is mandatory sort of thing, because otherwise the whatever is sticking to the teeth, that will keep sticking the whole night. And here
Okay.
again, don't restrict to the brushing, to the soft tissue also. Don't forget to clean the tongue also when we are brushing the teeth. Keep it clean. And the requirement of brushing varies with the age group also. When the baby is born, when the neonate is there, infant is there, or at the other spectrum of the age when there are geriatric patients, which may be even bedridden. And in the adult life, there might be some ill patients. So the requirement of the brushing changes according to the condition of the person. So we should,
Correct.
but definitely brushing, taking care of the soft tissues, the tongue, cleaning at the same time is important.
Perfect. Now, when I talk about oral hygiene, there are different tools that are there, that we all use. A toothbrush, a toothpaste. We have a tongue cleaner, dental floss, and then mouthwash. These are the things that at least I am aware of. So I would like to understand one thing at a time. So I want to pick up toothbrush. So you see it in the market. There are different kinds of toothbrush that are available. Soft bristles, hard bristles, crisscross bristles. Then very, very soft for people, those who have gum issues. So these things are there. How does it matter? Like, do we need what's kind of ideal brush that person should pick up? Or is it should be prescribed by a dentist?
Yes, brush is the most common instrument or the tool which is used to keep the mouth clean. So let us understand what is the requirement which is expected out of the brush. So any brush which fulfills those requirements can be utilized, though we have a lot of variety. So a brush is utilized to rub against the teeth, and by this friction, it cleans the teeth. So we should have a brush which is hard enough to give some amount of the abrasion so that the deposits on the teeth are removed. A brush should not be too soft, because in that condition, it will not be able to remove the debris which is deposited onto the teeth. On the other hand, it should not be very hard. It's not that will be cleaning better. Rather, in addition to the cleaning, it will abrade or it will remove the surface layer of the teeth also. And the tooth itself will be a reason for creating some of the cavities onto the crowns, onto the teeth. So it should neither be too hard nor it should be too soft. And a medium hardness of the bristles of the toothbrush serve the purpose of cleaning the teeth. It can be made up of any wood or any plastic or shape. That is the personal preference of any person. However, there are certain conditions even when the soft brushes are to be utilized. Like, for example, in the very young children, neonates, infants are there in those cases. Or when even the adult person has undergone some of the surgery into the mouth. For example, some person has got tooth extraction done, or some surgery on the gums has been done, stitches have been put. In that condition, a hard or the medium hardness brush will be very rough to the tissues. So only for some time being that during the healing is taking place, a soft brush is generally prescribed by the dentist, but that is only for that particular duration. So in certain condition, we should utilize very soft brush. so that it is kind to the tissues. But routinely, a medium hardness toothbrush should be utilized, neither too soft nor too hard.
Okay. And what about those shapes that are available in the
Yes.
market, zigzag and crisscross, and so many things are there?
So that depends upon the, like, if the person is, sometimes the person is teeth are not well aligned. Like specifically the last tooth is very difficult to reach. So with the very wide head, the brush itself cannot reach to the that area. So in that case,
Correct.
a narrow head would be indicated. So a dentist can prescribe with a narrow head of the toothbrush will be able to those hard to reach areas, because unless until a brush reaches an area, it will not be able to clean that area.
Okay.
So certain specific condition, like some young child is undergoing orthodontic treatment and is having braces, then the routine brush will not do. Then a specific brush which accommodates those brushes into the design, that is utilized. And as far as there is a special brushes for the young children also, they are softer, they are very attractive in shape, small head sizes there. And regarding the very young child, maybe newborn, for that, the special category of, I won't call it a brush, the cleaning aid is available. It is a sort of a cap which covers the finger. The mother can put this cap sort of thing onto the finger. It is made up of very soft silicone and it has some irregularities. There are no bristles onto that. So for the newborn, this kind of so-called brush can be utilized to clean the tongue of the infant.
Correct.
And in addition, one more thing I would like to add over here, the geriatric patients who are using denture, there is a special category of denture brushes there, which is having bristles on the both side of the head. Normal brush has bristles only on one side, whereas that has bristles on both the sides for different surfaces of the denture. So we should customize our brush as per the requirement.
Okay, that's perfect. The next thing is a toothpaste. So now we have so many types of toothpaste available: paste, gel, with crystals, with ingredients inside that. We have, commercial preparations. We have some Ayurvedic preparations. It has long and many things, are there. How to select the right toothpaste for yourself?
The purpose of the toothpaste is to simply act an abrasive with the toothbrush, so that some fine particles are there which are rubbed on the surface of the teeth with the help of the brush, and these fine particles help to remove the deposits which are on the tooth surface. So that is the purpose. So any toothpaste which serves this purpose is good. However, one should be careful that the particles of the toothpaste should not be too coarse or too hard. Otherwise, they will be too much damaging to the tooth surface. As far as consistency is concerned, that does not make any difference, because as long as the toothpaste is serving its purpose of being abrasive, it is a matter of personal preference. Some people might like one or the other form of it. So that is a general requirement. As far as medication is concerned, I think every medicated toothpaste should be taken after the consultation with the doctor, because every medication has some effect. It is prescribed to achieve some result. So medicated toothpaste should be taken after the prescription from a doctor only, because they should not be used for a very prolonged time. So they are used for certain specific period to address certain specific condition.
Got it. Now my next tool is dental floss. We all used to have that to remove, and especially after having food, we used to use it if we do not have time to actually go and brush, or if we do not have tools to go and brush somewhere. But is it a good practice, or what's your take on that?
Floss is another tool to clean the surfaces of the teeth. Why doesn't a brush work? Because if we have a closer look, our teeth are not flat surfaces. They are curved. And because of this curvature, there are certain curves areas created between the teeth, and where the bristles of the brush are very difficult to reach. So those areas are very difficult to clean with using the brush. And these are the areas which are most prone to collect the food debris when we are eating. So these are more critical to be cleaned. So to reach to these areas, dental floss can be utilized, which the purpose of using the dental floss is to clean the area in between the teeth.
Okay.
So that the gums remain healthy. And floss should be used by everyone because brush cleans only a few surfaces, remaining are to be cleaned with the floss. And using the floss once a day will serve the purpose, preferably at night. And how to use, I just now you made a gesture like this. Currently, we have other flosses available in which we don't have to wrap it around the finger, which are very convenient to use. So they can be utilized. And also, floss can be of very great help in certain situations when the access to the brushing is not possible, because everybody is working the whole day. So access to the brush and the brushing area is not always possible. So nowadays we have the dental floss in such a design which can be easily carried into the pocket or the wallet, and then they can be utilized anywhere. During the working days or during the travel time. So if even the brushing cannot be done in the daytime, the floss can serve to clean the area of the teeth in between the teeth. So that is a very good oral hygiene aid that maintains the hygiene when the brushing is not visible. But routinely, it should be done with the brushing at least once a day by everyone.
Okay, perfect. Now, the next tool that I have is a tongue cleaner. And this I have seen. So what's your take on tongue cleaner? How frequently we should be using it? And also there are two kinds of tongue cleaners. One is of a stainless steel and then other that we see is of a copper. So if you can tell me something about tongue cleaners.
Yes, very pertinent question. Because the surface of the tongue is a little bit rough, if I may say, it is corrugated. It has very small cilia onto it and they serve some purpose. Because it is irregular, some soft tissue projections are there. So tongue in the mouth is most likely to collect the debris. Whenever we are eating, it collects a lot of debris. So it has to be cleaned. As you said that the tongue cleaner can be utilized. It can be either made up of metal. Metal can be stainless steel or the copper. Or at times we see up some plastic tongue cleaner also.
Correct, yes.
But for everyone who's working and traveling, so it might not be possible to carry a tongue cleaner also. In those situations, even the toothbrush can be utilized to clean the tongue. After brushing the teeth, one can use the toothbrush to clean the surface of the tongue, the top surface of the tongue only. So that can be, the brush can be used horizontally to remove the whatever is the food debris collected onto the tongue surface. As for utilizing the tongue cleaners made up of metal or the plastic, one should use it, but be careful. It should not be too harsh. One should not make an attempt to remove everything, and tongue should not be made bald, because certain cilia which is present on the tongue, they are very much required for the health and for the taste as well. So while using the metallic or the plastic tongue cleaner, don't be too harsh on the tongue.
Okay.
And as far as the tongue of the babies are concerned, because when mother is feeding the baby and the neonate is there, even before the teeth are there, the milk gets settles onto the tongue, and the tongue, there is a deposit. So in that case, mother can utilize a very clean linen wrapped on the finger, index finger, and clean the baby's tongue.
Okay.
Or any brush can be. Similarly, for the geriatric, very old age patients, bedridden are there who cannot clean and who are edentulous, who don't have any teeth in the mouth. So that never stops that mouth should not be cleaned. In that case, also the tongue should be cleaned either with the brush or with the gauze piece or other clean cloth. So tongue cleaner is to be utilized.
Okay. Perfect. And the next tool that we all are aware is a mouthwash. Is it a good practice to use a mouthwash? If yes, how frequently we should be using it?
Yes. Rinsing is one of the very commonest methodology to clean the mouth. And mouthwash serves the purpose to rinse the mouth. However, it should not be used routinely. Mouthwash is generally advised to be used after brushing or in certain conditions. Why it should not be used routinely? Because all the mouthwashes are medicated, and very commonly they use alcohol. They are alcohol based. And in our mouth, we have a large number of germs, some good germs, some bad germs.
Correct.
Though we want to kill the bad germs through the medications, but we don't want to kill the good germs because the balance is disturbed. So this medicated mouthwash might kill the good germs also if it is utilized for the prolonged time. So all the mouthwashes are medicated. They should be used with the prescription only. Generally, for up to 2 weeks is okay, not for very long time. So if used for very long time, because these are the over-the-counter drugs and the person is thinking that it is a substitute to the toothbrush, no, it is not. So first thing, it disturbs the mouth oral flora, that is the good germs. So that affects the health. And since they are alcohol based, so generally they cause the dryness also. Dryness is not good for our mouth. Our mouth should all the time be wet. And if extended too much, if the use of the mouthwashes for too very long time, so some of the mouthwashes can even cause some staining of the teeth also, grayish staining. So mouthwashes should be used only when prescribed with the maximum of say around 2 weeks. However, in case somebody is in a situation when brushing is not possible, either because of some injury into the mouth or because of the restriction of the facility for the brushing, in that case, it can be used for rinsing the mouth, because at least it will clean the mouth to some extent.
Okay. Perfect. I think I don't have any more tools that I am aware of. Is there anything that I am not aware of? That these tools are there and I should know?
Yeah, these are the commonly used. However, in certain conditions, when the person is affected by some of the mouth problems, like specifically some oral cancers are there, some surgeries are there, jawbone is removed, soft tissue is removed, some grafting is done. So that time the patient's requirement changes, and a dental specialist is in a position to customize these oral hygiene aids. Another condition, somebody like some with the old age is not able to brush his or her own teeth. Suppose the arthritis is affecting the hands, then hand shape is not appropriate, hand movements are not under the control. And because of these orthopedic limitations, some person is not able to move the brush in a desired direction. So in that case, even the toothbrush can be customized to the requirement of that particular person, so that it becomes convenient for that person to use that brush. So depending upon the requirement of the person, customization is always possible.
Okay, perfect. And assume that all these tools are available. Usually, if I brush, in the morning and evening, probably I rinse after having every food and everything. Can I assume that yes, I have a good dental hygiene? Is it, or do I have to make sure that is there any parameter to check whether my dental hygiene is good enough or not?
You very rightly said the routine should be brushing, flossing, right, and rinsing. Regarding the rinse, I will suggest that instead of the mouthwash, if somebody feels, it will be better to use the saline, some salt in the water.
Okay.
Put some salt in the lukewarm water and use it for rinsing the mouth, because that will not cause the dryness. It is not medicated. It will not disturb to the oral flora. So that is a very good substitute. And also in our country, some people might not be able to afford the mouthwashes. So it is a very wonderful substitute for rinsing and maintaining the oral health. No, you cannot presume that you're maintaining the oral hygiene, because if the mouth is not kept clean, it is leading to some disease. And the unique nature of the dental diseases, it is painless. You will never ever come to know whether you are having the disease. So it is not appropriate to presume that hygiene is maintained. Despite that, there might be some silent disease which is progressing. When I say disease, it might be caries, the tooth caries, or it might be bone loss. Both the loss of the tooth structure as well as the loss of the bone into the mouth, if it is slow, both are painless and the person will not come to know. So the best criteria, prophylactically visit the dentist once in a 6 month, so that this disease, which is silently progressing, can be caught at the earlier stage.
Perfect. And it's not something is just coming to my mind. You talked that dental thing is not just teeth. Okay, we are speaking about the complete oral cavity. So tongue cleaner and everything will take care of, like tongue brush or brushing will take care of even the teeth that is not easy to access. What about the oral mucosa, gums and your buccal cavity that we talk about? How to keep the hygiene of that? I find that these tools, are this enough, or is there anything additional that we need to do?
Generally, what happens is that we have a constant supply of liquid or the fluid or the water in the mouth, the saliva.
Saliva.
So constantly we see something, and this saliva is regularly being flown into the into the mouth. The rate of this saliva flow in the mouth is more in the daytime, it reduces in the night time. However, this saliva is continuously pouring into the mouth and we are continuously swallowing it. So nature has given us a mechanism that it is continuously flushing at our mouth. So in a healthy adult, there is no need to use any additional device. But in certain conditions which affect this flow of saliva, it is reduced. Then the problem arises. It might reduce because of the one of the most commonest problem of the diabetes. Diabetes, the sugar problem in the population, that causes dryness of the mouth. The flow of saliva decreases. Also, in addition, specifically with the increased age, if some person is taking medication, many of the medications have their side effect to reduce this flow of saliva. So any of the reason that decreases this flow of the saliva causes dryness of the mouth. So
Perfect.
if our mouth is dry, then the stickiness of the food, like there are more chances that food will keep sticking to the soft tissues. As long as the mouth is wet, it will not stick to the lips and the cheeks. But if there is a dryness, then there are chances that food will stick to the soft tissues also. And later there might be problem in the speaking also. So in those conditions, we need to specifically clean the inside of the lips and the cheeks. For these, either we can use a very soft brush or even a small clean cloth will do. Or very softest of brush can be utilized for any of the soft tissues of the lips and the cheeks. And this is required only in condition when there is a dryness of the mouth and the stickiness and the food starts sticking to the soft tissue also, in addition to the hard tissues of the teeth.
Wonderful. I have just last two questions. One is, whenever we talk about dental care, it's not just cosmetic. You were speaking about just now. You were talking about diabetes. So the oral health is linked with our overall health as well, which diabetes is one example. So can you give a couple of more examples that maintaining a good oral hygiene helps us to take care of other diseases as well?
Yes, you have raised a very pertinent question. We cannot separate the oral health from the health of the rest of the body. And mouth is the gateway, we can say. So we have scientific evidence that oral hygiene and health affects almost majority of the organs. Like in diabetes, yes, there is dryness and it that is reflected into oral cavity because of the saliva or because of the medications. And because of the dryness, there are more chances of developing ulcers and cracks into the soft tissues. Patient will have more frequent ulcers. And if such patient is an old one using any type of prosthesis, also denture, then wearing the denture also becomes difficult. So the solution is that we have to have the moist mouth. So if the saliva is not generated from the body, then we have to give it artificially. So artificial saliva is to be prescribed. So the doctor will prescribe. But it also happens that apart from the diseases, the quantity of the saliva secreted in a day decreases normally also with aging. Sometimes the healthy aged person might require artificial saliva substitute to keep the health and hygiene of the oral cavity of the mouth.
Got it.
And because the mouth is it can affect the heart also. There is no direct linkage, but there is very strong scientific evidence that states that if the mouth hygiene, mouth cleanliness is not proper, it can affect the infection of the heart valves also. So one should be very careful that it can have a very dire consequences. And if the oral hygiene is not well maintained, then the number of the germs would increase. The load of the germs in the mouth will increase. Mm-hmm. And we know that the mouth is connected with the food pipe and the air pipe also. So this additional load of the germs might travel to the windpipe and thence to the lungs. So it can even aggravate the pneumonia which is existing, or it might be a cause of pneumonia. And this is specifically seen in the older age groups. So if it is severe, it might prove fatal also. Mm-hmm. So oral hygiene is having a direct bearing on the other multi-organs of the body as well.
Got it. Do we have, like, this is not a related, but because of the background and lots of research work and policy making work that you're doing, do we have any national program which makes it mandatory for either children or adult to actually do the dental checkup twice a year as you recommended? Do we have any such program, or is there in future we are coming up with such program?
See, forcing someone to go to the dentist is that's not there, not for the oral health or not for the body as well. But as a dentist, we do educate our patients that visiting the dentist twice a year when there is no problem is the best thing,
Okay.
because it is best to visit a dentist when you have no problem, because that time you don't need any extensive treatment, the expenditure is less, and the problem is caught at the earliest stage. So a stitch in time saves nine, because the person is not aware he or she is having any problem. But actually, the slowly the problem is developing. If it is caught at an earlier stage, the treatment is simpler, less costlier. And by the time the person becomes aware that he or she is having any problem, by that time, a lot of damage has already happened. Tooth structure has already been lost. Bone has already been lost. So it is very difficult to regenerate, or not humanly possible to regenerate a biological tissue. So then only artificial substitute is left, and the treatment becomes longer, requires your more time and more money and more efforts. So preventive visit to the dentist at least once in 6 months is a lot of help to everyone.
Perfect. My last question to you is there a message that you want to give it to people, those who are listening to us, in terms of their dental health care?
So I would keep my message simple, and the only thing is, preventing the dental problem is very simple. Just keep brushing at the right time in the right way. So you will never ever need to visit the dentist. And don't stop brushing anytime, because we are eating every day. So cleaning the mouth is mandatory every day. Another approach is that commonly observed among patient is patient goes for a treatment. A patient expects that something should be done in the oral cavity. Whenever anybody is visiting the dentist, one should ask, doctor, can you do that something that minimal of procedure is to be done in my mouth? Because replacing the natural with the artificial is not the best solution. Preserving what exists or what has been created by the nature is the best thing. So any person should be a very vigilant patient and always ask for very conservative treatment, for very minimal treatment or no treatment at all. So that is the best treatment.
Wow, this is beautiful. Thank you so much again to speak about oral hygiene, and you answered something probably people are not asking these questions, but these are simple questions, but I'm sure that everybody's thinking about it. Thank you for your time, doctor.
Thank you so much. Have a good day.